Hello, welcome back. I am going to put a little summary together here on this video to explain some a little bit more detail and decision making when it comes to determining that if prolotherapy, be it the tool of choice for a particular orthopedic joint, ligament, or tendon problem, how do you make a decision? How do I make a decision about what solution to use? The choices are many. After a recent December orthopedic meeting with the American Academy of Orthopedic Medicine, which was done virtually, lots of lively discussions and practitioners across the country utilizing different solutions discovered that we all have somewhat different approaches, and yet we all have some overlapping common grounds. So I wanted to at least mention that across the board there is a ton of information out there in the media. Not all of it necessarily substantiated. However, I can mention at least two areas, particularly with knee arthritis, and I'm going to pick up two areas, including elbow epicondylitis, epicondylosis, or tennis elbow, and also mention shoulder injuries that may include a partial rotator cuff tear, excuse me, as being pretty amenable to non-surgical approaches if physical therapy, if strengthening, if other tools have been implemented and we're still running into limitations with activity or function. So back when I was first exposed to the concept of prolotherapy, this is hats off to colleagues of mine who encouraged the training at the Hackett-Hamwall-Patterson Foundation, which is an associate organization, teaching organization with affiliations with the University of Wisconsin in Madison, Wisconsin. And when my first course began, it started off with a resounding benefit of results by doing injections in and around the knee joint using nothing more than dextrose, which is an inert sugar, which has been used for decades, but found that even in much more advanced arthritic knee joints, very high rates of improvement and benefits that continue to last and maintain for months to years. And that was something that was surprising to me, given the fact that we had previously reviewed people's x-rays, or possibly if they had MRIs, and found, boy, there's just a ton of arthritis there. I think you're going to need a surgery, either arthroscopic surgery or a knee replacement. They were finding that might not always be the case in every single patient example. And in fact, there were many that were delaying the need for surgery or intervention with regenerative joint solutions, including nothing more than dextrose. The fact that something as simple as a injection of sugar water could produce such an effect was astounding to me, and yet that's what this study that's still ongoing has shown. And it didn't matter the patient's age, and it didn't matter how severe the appearance on the x-ray plate looked. So many times in the past, if I'd see basically no joint space left, I'd just chalk it up to, well, it's time to replace that knee joint. But I've been surprised a number of times how often this technique can help waylay surgery or defer it for years down the line, all without needing steroids. So the knee joint has been one of the more studied, and dextrose, being the tool of choice, was shown in studies that went on for years that showed consistent improvements with folks with functional capacity, as well as showing an improvement on radiographs, showing an improvement with the joints themselves. So to think that dextrose can do something as remarkable as that continues to be a very favorite tool. Dextrose does not affect somebody's blood sugar levels. It can be used very safely in diabetics. It can be used very safely with some caution and caveats in patients with autoimmune disease. But there's very good applications in orthopedic and sports medicine using dextrose-based prolotherapy. I'd mention plasma as another tool that I use to help with the body's healing mechanisms, which in my on my website, as well as links in my blogs regarding prolotherapy, talks to specifics about mechanisms. But safe to say that what the patient's own plasma, by injecting it into areas directed at pinpoint areas that may be areas of damage or trauma, which includes the patient's own growth factors, helps the body's own healing mechanisms come to that area and help the healing mechanisms to repair tissue, actually reorchestrate what had been possibly damaged maybe years ago. And it has a much more research-based findings with plasma or platelet-rich plasma over the years that have continued to prove themselves in areas that in the past were only theorized. So the two areas I mentioned, the lateral elbow in folks who have lateral epicondylitis, or if tennis elbow sounds familiar. I usually find it by the time I get to see patients, often it might be months or years that they've had that. And in my world, we tend to refer to that as epicondylosis, or more of a chronic osis or a dysfunction problem affecting connections of ligament to bone, ligaments themselves, sometimes fascial connections to bone from muscle structures. And these areas are often tender, they're sore. Those are the areas that we tend to find to be worthy of treatment. So as my former teacher, Dr. Jeff Patterson, used to say, your fingers will find the areas that are usually in the most need or in need of treatment with prolotherapy injections. So those areas are carefully marked out, and with palpation, they are treated with a series of injections. And on the elbow, it turns out that plasma, so PRP or platelet-rich plasma, has actually been shown to be extremely effective in reversing this problem, that for some, they maybe have been dealing with this for months, if not years. And in my literature in family medicine and sports medicine, it's one of those things a lot of people just say, well, put some steroids in it and eventually it'll go away after 6 months, no matter what you do to it. Well, turns out you can do other things to speed that healing process up, and that would go very well with physical therapy approaches. So again, why would I not want to offer something that would help speed the recovery process up? Some of my colleagues and senior teachers across the country who work with seasoned athletes, collegiate athletes, they're using these techniques to get players back on the field, if you will, within weeks. And I'm always remarkably impressed how some of these techniques can help people stay in the game, if you will, especially if they've been sidelined by injury or trauma. This is a technique that can be very, very helpful and useful for long-term recovery. I would mention that the shoulder was mentioned during this orthopedic conference in the fact that if you have tears affecting a structure in the shoulder, and I'll use an example. One of the tendons that we incorporate or include as part of the rotator cuff in the shoulder, the supraspinatus. You could pick another. You could pick the infraspinatus. If these areas on ultrasound or MRI imaging are shown to have partial tears, the fact that you can visually see these with ultrasound guidance, which is a tool that I've found to be immeasurably helpful to isolate and localize these areas with high-resolution ultrasound, you can actually see these small tears, and directing your needle directly into the area of the injury gives you much more precise ability to heal these tissues with plasma. So this is not a technique I would personally suggest and recommend for somebody who has a complete tear of a ligament that I would want an orthopedist to take care of, because those often may require surgery. But for partial tears, an example of a patient I'm currently working with, it's a very viable option to go along with her physical therapy approaches. So in that case, basically what the patient is asked to do is we have a phlebotomist obtain so much of the patient's own blood. The patient's blood is spun down, and after 5 minutes approximately, the centrifuge brings out what looks like straw-colored serum or plasma that's drawn off, and that solution is all that's needed, other than a little bit of lidocaine for local anesthesia. But that solution goes right into the area of the damage, right into the area that we need to be directing our efforts for healing. So there's a bit of a thumbnail sketch on decisions. Do you use dextrose? Do you use PRP? And there are many other appropriate solutions out there on the market. Those are the two that I focus on the most for my own patient population, so I figured I'd focus on those for this video. So hopefully that helps, and obviously if any questions about prolotherapy, about what PRP may be able to offer, don't hesitate to contact me or direct it to my front desk so we can possibly see if we can be of help to you. Alrighty, thank you for watching this video, and take care of yourself. Bye-bye.